Hey, counselors, welcome back to LeeBella Coaching and Counseling. I'm Scott Spiers, a licensed clinical addiction specialist and clinical supervisor in North Carolina. Okay, core function number 4. This honestly is a monster core function. So let's see if we can tame this beast. I'll admit this has taken a while because I didn't like the other 6 versions of this. But my latest coaching clients, I would love to give them a shout out, but I didn't get their permission. But I just got off of a spontaneous coaching call with someone, and I'm inspired. And I had to remind myself, don't overthink this one, although there is a lot here. And then at the end, I'm going to have some closing remarks and an opinion. I really would like it if you hung out and down to the very end, because there's some important things about this core function that aren't on the exam, but I think they're worth every counselor to know. Okay, core function number 4. We've done the first 3. This one, here's where the counseling skills come in. So reading it as is, it is simply the procedures, not procedure, the procedures by which a counselor or a program identifies and evaluates an individual's, remember these, strengths, weaknesses, problems, and needs for the development of the treatment plan. If there are any buzzwords worth knowing in here, it is strengths, weaknesses, problems, and needs. Gather relevant history from the client, including but not limited to alcohol and other drug abuse, using appropriate interview techniques. Global criteria 2. Identify methods and procedures for obtaining corroborative information from significant secondary sources regarding clients' alcohol and other drug use and psychosocial history. That's an important one. Psychosocial history. Next one, don't sleep on this. Identify the appropriate assessment tools. Remember, if it says screening on the tool, it's for core function number 2, which is screening. If it says severity in any way, shape, manner, or form, then it's going to be an assessment tool. Next, explain to the client the rationale for use of the assessment techniques in order to facilitate understanding. In my opinion, that's the most important part, not necessarily for the exam, but that's a really important one that I hope you all keep near and dear to your heart. And then finally, develop a diagnostic evaluation of the client's substance abuse and any coexisting conditions based on the results of all assessments in order to provide an integrated approach to treatment planning based on the client's, here they are again, strengths, weaknesses, and identified problems and needs. Okay, let's look at the global criteria one at a time. The first one is the first one is gather relevant history from the client, including but not limited to alcohol and other drug abuse, using appropriate interview techniques. That means we're looking for the biopsychosocial history. And biopsychosocial is one of the addiction theories, right? It's a biopsychosocial model. So it's actually embedded, baked in to the core function. So we're going to want to know the family of origin history. Do any family members have a history of substance abuse or any mental health disorders? We're going to want to know about their cultural program. Where were they born? Where were they raised? Was the family together? Was it divorce? We're going to want to know their education level and experience, and if their use of substances interfered with their education experience. We're also going to want to know if substance abuse affected their work or their occupation in any way. And that's a bit of foreshadowing for DSM-5 diagnostic criteria. We're going to want to know if they have a history of trauma or abuse. Of course, we're going to want to know their substance use history, their preferred religion or spirituality, and any prior treatment that they have. With this, the appropriate interview techniques, very simply, um, generally motivational interviewing, so open-ended questions. You want to be friendly. You're going to get resistance. You're going to feel like there's something else going on here. Don't dig. We're not detectives, okay? Motivational interviewing, be open, be engaging. So that's global criteria 1 for that. Global criteria 2 is identify methods and procedures for obtaining corroborative information from significant secondary sources regarding clients' alcohol and other drug abuse and psychosocial history. Remember, back into core function 2 intake, um, your releases of information. This is key. This is how core function 2 leads right into core function number 4. So you're going to want to have their prior treatment history. You're going to want to get release information. You're going to want to get their diagnosis, their course of treatment, if applicable, any progress notes, and then any discharge planning or exit plan that they have. You're going to want to know any criminal record, especially if you deal with probation and parole a lot. Again, you're going to need release information. And when you look at 42 CFR and HIPAA, it's not good enough that they get the release information from their probation officer or parole officer. You're going to want to have them sign that on your end as well. So it's a two-way street. You're going to want to know any relevant hospitalization. Have they had any surgeries? Have they had any accidents? Did any of that have anything to do with their substance use? You're going to want, in some cases, family and spouse input. It's on the exam. Honestly, I haven't seen that very often, but who is a more valuable source of information? After it comes to the client or the patient, it's going to be their family, their friends, their relatives, but you really need to get release information and keep your boundaries really clear when you do that. You're also going to want, if the church or any spiritual advisors, a lot of churches have programs, and they're great programs. A lot of them are staffed by volunteers. So if you can get any information from them, that would be great. And of course, this should have been first, but whoever the referral agency is, whether that's Department of Health Services, Child Protective Services, a doctor, or another treatment provider. So those are going to be methods and procedures, right? Release information, you send them a request, and sometimes they want you to fill out, especially hospitals. Their paperwork can get a little bit tricky, but that's how you do it to get corroborative information from secondary sources. Our next global criteria is identify appropriate assessment tools. Remember, this is not screening. Okay, so if the instrument that they're presenting in the exam has anything that says screening in it, that's going to be a screening instrument like MAST, DAST, etc. Don't get lost in the minutiae of this. There are hundreds of assessment tools. If I'll be honest, if I'm going to miss one or two questions on exam, me personally, it's probably going to have to do with this. Now, here are just a handful of common um, assessment tools that are good chance they're going to be on the exam and a good chance you're going to deal with them in real life. The first one is called the ASI or ASI, if you want to be politically correct. That's the Addiction Severity Index. Right there's your clue. As soon as it says severity, you know it's going to be an assessment tool. Then you have the SALSI, which is the Substance Abuse Life Circumstance Evaluation. That is an assessment tool. You mental health counselors and social workers, sigh of relief. Here's a few that you know, and addiction counselors should know this because a lot of insurance companies, including Medicaid, Medi-Cal, if you're in California, Medicare, Blue Cross Blue Shield, they're going to want you to do things like the PHQ-9, which is a depression questionnaire. You're going to want to know the GAD-7, as the Generalized Anxiety Disorder 7-item test. A tricky one, this might not come up, but it's very helpful. If you're dealing with people with withdrawal, especially post-acute withdrawal, the ISI, otherwise known as the Insomnia Severity Index, and then finally there's the World Health Organization Well-Being Index. And these are assessments that you give throughout the course of treatment. I do all of my patients, I see them through Headway. Headway has not sponsored this. I don't get any remuneration from them, but I'm going to give them a shout out because with Headway, I have I have the PHQ-9, the GAD-7, the ISI, and the World Health Organization Well-Being. And I get to use that. I can schedule it to be sent out to them every week, every month, whenever I want. Extremely helpful for me to have. And then come to think of it, let's not forget, this is an addiction counseling exam. So other assessment tools, and people don't think of it this way, but the ASAM, the American Society of Addiction Medicine, their placement criteria, that's an assessment tool. You're taking the relevant information, and it's not giving you a diagnosis, but it's telling you where to place them based on the criteria they have within ASAM. And then you also have the stages of change: pre-contemplation, contemplation, preparation, action, maintenance, relapse, and exit. So these are assessment tools. And let's not forget, the number one assessment tool for anybody in addictions is going to be the DSM-5. Next, we have explain to the client the rationale for the use of assessment techniques in order to facilitate understanding. Please don't ignore this. It's easy to memorize, it's easy to know, but I'm telling you right now, take the time and explain to them what the PHQ-9 is, what it's being used for. Explain to them whatever your assessment tool is. This is the moment where you can build trust, where you're actually getting a therapeutic bond with the client. So please be kind, patient, and confident when you're doing assessments. Clients, a lot of times, can present they're confused, they're scared, and they're intimidated, or they're angry, defensive, and hard to work with. This is motivational interviewing 101. If you explain what's going on, talk to them like they're a mature, responsible adult, it's a great opportunity to build therapeutic bond. Next up, and here we go, this is the big one, okay? Develop a diagnostic evaluation of the client's substance abuse and any coexisting, otherwise known as co-occurring conditions based on the results of all assessments in order to provide an integrated approach to treatment planning based on the client's, here they are again, strengths, weaknesses, problems, and needs. This is where the gotcha of this is. For certified counselors, you definitely want to be extremely familiar with the DSM-5 criteria and the diagnoses: mild, moderate, and severe. And you're going to want to know what the course specifiers are. That would be partial remission, full remission. Also, you want to have basic mental health. Now, if you're certified, you cannot diagnose, and you really are limited in your ability to treat basic mental health, but have an understanding of the differences between depression, anxiety, and personality disorders such as borderline personality, narcissist, um, avoidant, dependent, histrionic. You want to be familiar with those, which is really handy when you're consulting with other professionals later on in the core functions, both certified and licensed. Okay. Understand the acute intoxication of effects of substances and the withdrawal effects. Don't forget, this is an addiction counselor exam. And if you don't know what the withdrawal symptoms for cocaine are, you can't really assess for them. Yeah. If you don't know what the withdrawal symptoms of opioids are, it's really hard to justify medically assisted treatment. At the same time, you also want to know the acute intoxication effects. So, I mean, drugs mimic mental health orders, both in the acute intoxication and the withdrawal. And we don't think of this in terms of assessment. But the more you know about drugs of abuse, psychopharmacology, and the presenting withdrawal symptoms, that way you can come up with a course of treatment, you can have a more accurate treatment plan, you can develop better interventions. Finally, licensed counselors, yeah, you need to be even more familiar with mood and personality disorders. You're going to need to be doing what's called differential diagnosis. For example, I think the most common co occurring diagnosis I have is anxiety. But after a while, you start to realize, well, anxiety is a withdrawal symptom of alcohol. And then after about 90 days or so, that particular anxiety diagnosis can, in many ways, go away entirely. And in most cases, is at least going to go down. So there is a difference between withdrawal and a mental health condition, but they can both present looking like the same thing. So this is where your skill as a licensed clinician is really going to come in. And that's it for the global criteria. There's a lot of information there. You're going to want to be familiar with assessment tools. You're going to want to be able to tell the difference between assessment and screening. You're going to want to keep in mind that the purpose of assessment is to give a diagnosis based on DSM 5 criteria and then ultimately do a treatment plan. Now, this is my opinion part of it. Assessment doesn't just happen in the assessment phase of someone coming into your facility. If you're doing a DAP note, which some people say is data assessment prognosis, you're doing assessments every single time you're doing a note. So this is a lifetime skill that takes a long time to develop. Your assessment skills are going to greatly impact your counseling ability. The better that you can objectively assess your patient, your client, of what's going on with them, the better counselor you're going to be. The other thing is your biases are going to cloud your ability to do an accurate assessment. If the only thing you know about treatment is 12-step facilitation, then you're always going to look at from the lens of Alcoholics Anonymous, Narcotics Anonymous, and total abstinence. If they're not abstaining, it's a failure. We need to assess a little bit better than that. That's why we have other tools like the ASAM placement criteria and the stages of change. Both of them really good assessment tools. Patients initially in your first assessment session, um, they're probably not going to be providing like horribly accurate information. You've known them for about 10 minutes when you're doing the initial formal assessment. So you're going to get much different answers potentially, a week, 2 weeks, 3 weeks. Once the fog starts clearing, once they trust you a little bit. And to be honest, when you're doing an assessment, you're asking them questions they've never really thought of before. So give them a little break. It is totally common for someone to say, "Ooh, I only drink 3 beers a day." And then, 2 weeks later, they go, "Well, honestly, it's 12." That it simply happens. That's the nature of the beast. That's why you're getting these fantastic counseling skills using evidence-based tools like motivational interviewing and the stages of change. So, when they're talking to you, they haven't had a treatment experience yet, or they might have had a bad one, or they're confused, or they're hungover, or gosh knows what. So give them a little bit of grace. Please always remember, assessment is not interrogation. We don't have detective badges. That's why you want to use corroboration and secondary sources. So be kind with yourself, be gentle, learn the art of assessment. You're going to do fine. Be kind and gentle with your patients. They're going to give you more accurate information. And remember, assessment happens every time you have a session. Assessment happens when you're doing exit planning and discharge. So, assessment isn't a one time only thing, it's one of the prime essential skills. And if you really lean into assessment, get to know the process and maybe even enjoy it, you're just going to be that much of a better counselor. That's all I have for today. If you have any questions, please let me know. I have my Psychology Today profile. If you want to do any coaching, remember my initial consultation with you is free. My goal is never to get you. I mean, if I have to do 5 sessions of coaching, there's something else going on here. So don't be afraid. Just let me know. And I will see you next time for core function number 5. And in case you haven't figured it out, treatment planning. See you then.